Good morning, everyone. Gareth Presch, founder, CEO of the World Health Innovation Summit. I am delighted to welcome you to the World Health Innovation Summit online this year. This morning, we're starting off with the future of healthcare and economic growth. I'm joined by Dr. Amir Hannan and Roxanne Lavie and Denis Naughten. We face serious challenges in healthcare. We're predicted to be short of over 18 million staff by 2030. World Health Innovation Summit has a vision to empower people, to give people the tools to manage their own health and well-being. And what we're trying to set out here is a new model of healthcare based on prevention at scale. Let me bring in my guests and let's start with a round of introductions. Denis, you're joining us on Election Day in Ireland. You're very welcome and the floor is yours.
Thanks very much, Gareth. So I'm a former member of Parliament in Ireland. I was directly elected in 6 elections over 27 years. I've been a former minister in Ireland for communications, energy, natural resources and climate action and environment. And I've just recently stepped down as chair of the Interparliamentary Union Working Group on Science and Technology. And the Interparliamentary Union is where parliaments come together every 6 months. It's like the United Nations, but it's where parliaments and members of parliament come together. And we've had a working group of 21 members of parliament looking at how we can build stronger relationships between science, technology and innovation and parliament.
Thanks, Denis. And Roxanne.
Hello, good morning, everyone. Thank you, Gareth. I'm a patient. I'm here primarily as a patient, and I'm the founder of Cassandra. We're a platform to give patients the tools to advocate for themselves, explain their goals and needs in medical interactions. I'm also part of the patient partnership program at the Hospital of Geneva in Switzerland, and that's an initiative to include patients in conceiving care and the hospital from admin point of view to communication and procedures. So that's an initiative that's very close to my heart, where we're part of the same team to deliver best care.
Yes, and Roxanne, we met in Helsinki. You were one of the as we say the chair of the Radical Health Festival.
Yeah, you can say it like that. Yeah.
Fantastic. Let me go to Manchester. Dr. Amir Hannan, our chairman.
Hi, and thank you very much for inviting me, Gareth. And it's wonderful to be part of this program. So I'm a GP, a family physician here in Manchester, in Greater Manchester. I work 4.5 days a week, 9 sessions in a GP surgery, so that's my day job. But I'm also chair of the Association of Greater Manchester Local Medical Committees, and of course, chair of the World Health Innovation Summit. I believe very, very strongly that people should have access to their GP electronic health records, but also have this partnership of trust between patients and clinicians who know each other and a system that supports them. And I'm really looking forward to the discussion today.
Thanks, Amir. So let me just set the scene for everyone who's joined us. And if you do have a question for any of our panelists, please pop it in the chat. Firstly, over 3 billion people don't have access to healthcare. And this is something that we have to change. And when we look at the numbers, it's just, it's shocking. And when we look at the spend and the economic power behind healthcare, it's about $10 trillion. And I think that shows the size and the opportunity around economics. If you look in the UK, for example, it's about 9 million people are inactive at the moment. And we have about 2.5 million people with ill health who can't actually work at the moment. It costs about 150 billion to the UK Exchequer. And I'm going to ask some of the questions now. Denis, firstly, how can a proactive focus on health and well-being drive economic growth within communities and countries?
I think, first of all, there are a number of hidden challenges, I think, there at the moment within our health system that need to be addressed. One of those is disability, and the other one is chronic illness. And disability comes in 2 formats, as we know, both physical disability and mental health illnesses. And we've seen, particularly since COVID, that these problems have exacerbated. We've seen in relation to demands and pressures on our mental health services, particularly for older people and young people, but also in terms of physical illness. We have now this concept of long COVID, which is becoming a far bigger problem, and is now being cited as one of the major contributors to labour shortages across the world. In fact, Dr. Zaid Al-Ali in Washington University in St. Louis has suggested that the toll of long COVID in the United States alone is impacting on the economy there by about $3.7 trillion. That's the same impact as the economic recession in 2008. So there are big challenges there in relation to that. In Europe, Eurostat say that 1 in 4 people over the age of 16 in Europe, just over 100 million people, have a disability. In terms of chronic illness, then, in Europe, you have about 35% of the population self-declare that they have a chronic and ongoing illness. And again, this has a huge burden on our economies in terms of workforce, but also in terms of the burdens on our health service. And of course, the economic aspect of that isn't just an output aspect of it. You have the lack of taxpayers contributing, paying towards pensions. That puts further demand on immigration coming in. And that leads, particularly in Europe, has led to an awful lot more tensions. And we see that in the United States today. So I think what we need to see is a renewed focus on some of these challenges. And as we know, many of them can be managed very effectively or can be reduced, particularly in terms of chronic illness, by addressing things like smoking, obesity, physical inactivity. We also have growing issues like air quality. And we know now that air quality has an impact in terms of chronic illness, but also in terms of brain activity for older people, learning ability for young people, and even the fertility rates now for men impacted by air quality. And I suppose then you take something like long COVID, which is a post-viral syndrome. We're now beginning to see evidence emerging of other conditions associated with post-viral infections, ME and chronic fatigue syndrome, but also multiple sclerosis, Parkinson's disease, Lyme disease, and Alzheimer's disease. There now seems to be an association there. So all of this is a confluence of challenges that are there. We do know that there are opportunities to address this, but how do we go about that? And I think data and innovation and that interface with artificial intelligence provides us with really exciting opportunities now to address some of these challenges. We've wearable technologies, we have generating huge amounts of information, but how can we utilize that? And in terms of artificial intelligence, the big challenge for us as legislators and decision makers is that we have to try and carefully balance the opportunities with the potential risks that are there. And how do we regulate technology that isn't clearly defined? We don't really understand the concepts. We're trying to protect against risk, but not stifle innovation. And I think what we need to do is look at how we can deliver on some of these complex challenges. And one of the things we've been doing within the Interparliamentary Union is looking at how we can improve engagement with citizens. We've developed a tool for what's called human security, which is putting citizens at the core of the decision-making approach to policy. We're also looking at innovation because innovation requires robust regulation. And one of the things that I have done within the Interparliamentary Union, we've led a team of MPs that have secured global parliamentary agreement on developing an ethical charter for science and technology. And this is a charter that acts as an overall guiding framework for all innovations in technology, not just artificial intelligence. And in tandem with that, last month in Geneva, we secured agreement from 130 different countries, represented from parliamentarians from those countries, on the impact of artificial intelligence on democracy, human rights, and the rule of law. And I think using those type of tools, we can help to develop some of the solutions. But the big challenge is that decision makers look at the cost in terms of money, but also the cost in terms of hard decisions. And we don't look at the long-term benefits. We're looking at the problems here and now, because we look at issues whether we're ministers or parliamentarians in parliamentary cycles. And two things that we've done in Ireland that have helped us to break out of that mindset has been through the parliamentary committee system. One of those has been in relation to foresight. We've developed a healthcare plan, a long-term healthcare plan in Ireland called Sláinte Care. And what we've done is we've said back 15 years ago, what type of a health system do we want by 2030? And we've got all party agreement on a roadmap to actually deliver that, working with the academic community who said, this is how you achieve it. These are the tough decisions that are made today. And we've got buy-in now from all of the political parties in relation to that. And as a result of that, got community acceptance. Another thing that I was directly involved with myself, chairing a parliamentary committee, was we worked with the communities on our offshore islands, looking at the health services there. And we had the University of Galway doing some research on remote healthcare and remote diagnostics. But rather than get the academics to present to the parliamentary committee, we actually got the islanders themselves to present, telling us about the impact that these technologies have had on them, the difference that they've made to their own lives and to their own health outcomes, complemented by the evidence from the academics. But actually, by turning things on its head, by focusing on the citizen and the impact on them, we're bringing consent and agreement across the board, both in politics, in policy making, and in decision making.
I think, like Denis, the points that you're making there about engagement and how this was very much the focus of the Radical Health Festival. Roxanne chaired it a couple of months ago in Helsinki, and the Finnish are well known for early adoption in terms of new models of healthcare and that proactive approach. I'm going to bring in Dr. Amir Hannan shortly. Just how do we bring in and the health sector into this as well? But we do actually have a model, and unfortunately COVID hit, because I had actually met with the health service executive to discuss Sláinte Care. We had developed a pioneering model using community engagement and being proactive. We myself and Amir and other colleagues had been working in the UK here. We had events in Nottingham and Manchester, and we were able to demonstrate, Denis, by engaging with communities, £1 invested, 36 back. I mean, and this was all evidence-based. My job in the department previously when I worked in blood policy was to make sure that the policymakers could make those decisions like yourself. And that's what I just took that metrics and used the same metrics and applied it into the community. So the opportunity is there, and the opportunity to create new and meaningful jobs is also there. I think what's very exciting is be able to create a circular economy within the health sector, because the health sector is a huge industry, and you can anchor in the supply chain to support events and activities. That money then can be reinvested back into programs that generates economic value, as in offsetting people being ill. So it's a win-win. And at the same time, the government takes 50% back in tax returns. So it's a win-win for everyone. Amir, I think this is really important in terms of, what role, do you believe the health sector plays in creating sustainable economic opportunities? I mean, you've been with me working on this for the last 10 years. How can the health sector embrace this?
So the purpose of healthcare is to promote, maintain and restore health, prevent illness and improve the overall quality of life for both individuals and also wider communities. If we think about the World Health Organization's definition of health, it's a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. Mahatma Gandhi said something very profound, and that is that your health is your greatest wealth. And that's why there is a direct link between how healthy we are and how wealthy we can become in economic prosperity, as you described. And the question to ask is, well, what role does healthcare have in this? Maslow's hierarchy of needs is, I think, a really useful concept. It's certainly helped me to understand the wider picture, if you like. And it defines 5 levels of needs that people have, like a pyramid. You start at the bottom. You don't need everything, but you do need some of them in order to progress. So at the most basic level, there's the physiological needs: food, water, shelter, and rest. Of course, those are things that require some sort of economic prosperity to be able to provide those things. But once you have those things, you can then go on to develop safety needs, that's security, stability, freedom from fear; social and belonging needs, friendships, intimacy and acceptance; esteem needs, respect, recognition and status; and then finally, self-actualization needs, achieving one's full potential and creativity, and what we're all trying to achieve ourselves and for our loved ones. But to get there, we're going to need an equitable access to healthcare, and perhaps even justice, where the barriers are taken down so that all can access not just medical care, but social care as well. And that's one of the challenges that we've got, is how do we reach out to as many people as possible, recognizing that certain groups of people, those who are more disadvantaged, are going to need more help and support than those that don't. Of course, the economic opportunity requires a healthy population where that justice and fairness prevails, so that those with the greatest need are more likely to get the support they need to help them exceed their potential. That means healthcare needs to be high quality, safe, and a great patient and staff experience. A lot of my work in the first 10 years, I've been a GP now 25 years, and perhaps the first 10, 15 years was a lot about patients. That's my day job. But I began to realize that if we don't invest in our staff, then they get left behind. And if we don't have healthy staff, then they're not really going to be able to help the patients that we serve. But healthcare needs to be accessible, affordable, personalized, dependable, working with people and communities, recognizing the assets they have, not just the deficits, and encouraging people to grow, earn a decent living, look after themselves, their dependents, and those they care for, including their neighbors and friends. In many communities, healthcare is the biggest employer, and hence it has a direct role, not just in looking after other people, but also ensuring that the very people that work within the system also have a decent living wage so that they can prosper too. The data the system has about us, the notes that I'm writing in the records when I see patients, for instance, also has an important role for us to play. I don't believe data per se will save lives. There's loads of data around already, but do we have the right context? And can we engage people whose data it is, or it pertains to, especially if we want to collect what matters to them too, rather than just what the system wants? The citizen or the patient, and also those who collect it, the clinician. As we start to collect the data that matters to us collectively, patients and clinicians, we can build this partnership of trust that I've talked about by enabling responsible sharing of that data for those who need it, including the patients, citizens, as well as the system leaders, as well as the clinicians themselves, and providing trusted information for all to understand what it all means and make this a right for all human beings, wherever they are throughout the world, to have, so that we can improve outcomes for all. Increasingly, I think artificial intelligence, based on such data, will help us to plug gaps and maximize the opportunities for both citizens, patients and the public, and healthcare givers too. Just ask ChatGPT or its equivalent, what can I do to improve my health? And you'll see what role healthcare has in creating sustainable economic opportunities for all.
Thanks, Amir. Now, Roxanne, this is very timely for you from a patient's perspective. I mean, Dr. Amir Hannan talked about the partnership of trust. This is quite a loaded question for yourself now. How can we shift the current healthcare model from sick care to the one that prioritizes health promotion and disease prevention?
Thanks. I think that's the dream. But I think it's harder than that because people define sick differently. And if we go back to the World Health Organization definition of health, and we're looking for a total state of well-being, then we're virtually probably all sick. And in this context, I think what matters is therefore what it is important to each unique individual, what they define as health, what is their own vision of well-being, rather than projecting quantity of life or a level of functionality of the body or the mind. And I think already equipping people with even with just the question, allowing them to reflect on what matters to them and what help they would need, what support they would need to get there, is fundamental. And we're not there today. We're very much from a patient asks for help or begs, and then it's over to the doctor to sort them out virtually. And that's also because we don't necessarily recognize the importance of the patient in setting the goal for their own health. That for me is a very big thing. It's a cultural mindset shift that is required. And then in terms of patient, what we can do is just, I think it's not postpone. We all burn ourselves out because we can't do that later. We have our priorities wrong sometimes. And I think, in fact, employers have a really big role to play there. If we want people to remain healthy so that they can work and produce value economically, we need to rethink the system of work as well. I think the younger generation are already there in terms of work-life balance, in terms of I want a workstation that keeps me healthy. I want food that keeps me healthy. I want my time for lunch and so on. But I think that's really a big thing, is thinking about life in general and all spheres of life and not just health.
Yeah, and maybe share a little bit of your experience, Roxanne. Maybe share, where you've come from, because you've been on that patient journey. Just share that with the audience, because I think it's important that we set the tone.
I'm still very much on that journey. So the part of the journey started 10 years ago when I was diagnosed with breast cancer. And I think it was very hard, but at the time I was living in Geneva. I received extraordinary care. But I had one moment that came to me as an epiphany. Nurses asking how I'm doing. I'm like, yeah, all considering, I'm fine, mostly because I don't want them to feel like I'm not grateful for all their care and work. But she picks up on it and she's like, you do look fine. You need to be the captain in your ship. We need your feedback so that we can steer the ship in the direction that works for you. And I think that was very, very important to me, because not only I had a role that I could play, but it was very clear that they needed me to play that role. And that allowed me to give feedback, to complain, to change treatment, to say when things were not working. 10 years on, I'm cancer-free, touch wood. I don't think that's just the reason, but it's definitely a part of it. And later on, I had trauma from sexual violence in childhood. And because I have a gynecological cancer predisposition, the follow-up has been very difficult. But that experience taught me how to frame what I need, what I'm worried about, so that the examinations can be performed, so that the test can be performed, so that I will feel safe and not avoid them forever. And I found the right doctors for all that within the NHS system. So I know it can be done. I know it's very difficult, and it takes a lot of energy and cognitive effort as well from the patient. And that's what I'm trying to do with Cassandra, to make sure that people don't have to learn the hard thing at the hardest times.
No, I think it's brilliant. And what you're articulating here is, Denis, I got to come back to you now, because we need to look at how do we shift policy. And Ireland, in many respects, has pioneered this, particularly around the blood transfusion scandal in the 70s and 80s of contaminated blood products. And where I seen how powerful a patient voice can be was through the haemophilia community and working with government. That was very much the principle of the World Health Innovation Summit, was how could you bring, your patients, your clinicians, your managers, the voluntary sector, education and the business community together to be able to solve these challenges and come out with a new policy. So I want to bring Denis in now, and just Denis, perhaps what policies or investments are essential for building a healthcare system that not only treats illness, but actively promotes health and economic development?
So I think, look, I'll just pick up on some of the comments earlier and come back to this question here. Dr. Amir spoke about the issue of the challenge with data and the usefulness of data. But there's the huge trust factor as well in relation to it. And look, this is something we're all grappling with at the moment. Who has access to my data? How is that data being used? And I think what we need to do is to turn this on its head, coming back to the comment that Roxanne has made, and give the control to the patient. The records should be held on this device. The individual should hold the data, and then they decide which clinician is given access to what data. And they need to be given the capacity and understanding so that they can make some of these decisions. And I think Roxanne is right. And I think Dr. Amir is right. You build trust by giving ownership and control to the individuals themselves. But you can only do that effectively if the patient has the skills and capacity given to them to make those decisions. And giving them, we all talk about informed consent. And the reality is, that can be very hit and miss with individual patients. How do we proactively do that? And one of the things, as I say, that we've been developing within the Interparliamentary Union is this concept of human security, where you look and focus on the individual within a community, but you give them the capacity to make decisions in the first place. And in Ireland, we've done this very well with climate change, where we've had engagement at community level. We've brought the experts in, given the individuals the information and the citizens the information, and then ask them to come up with solutions in relation to it. And it's a ground-up approach rather than a top-down approach. Coming to the questions you've asked, Gareth, I think one of the key challenges here is to look at co-benefits. So, clinicians that come to me, and Dr. Amir or anyone else that comes to me, will look at it purely from his perspective and maybe the patient perspective. Roxanne will have a different approach in relation to it. The officials within my department will be saying, well, Minister, this is going to cost you this amount of money. What are you going to cut back on to do that? So one of the things I did when I was Minister for Climate Action in Ireland, and we were doing deep retrofitting of homes, looking at the impact it had in terms of energy consumption and climate emissions. But as Minister, I commissioned the London School of Hygiene and Tropical Medicine to do an evaluation where we actually targeted homes of families with COPD and with asthma. And the outcome of that was that those patients with those chronic illnesses, they were attending the GP less, they were attending emergency departments less, they were using the health services less, and they were more comfortable in their own homes. They were avoiding going back to step-down facilities if they had to be admitted to hospital and going directly home. So here was a synergy between energy efficiency, climate action, and health outcomes in terms of indoor air quality. The same can be done in terms of climate action measures with outdoor air quality. And we see now the World Health Organization is highlighting that 99% of the global population is being directly impacted by poor air quality in one form or another. If we can clean up our air, we're reducing our climate emissions, we're also improving health outcomes. So what we need to do is to bring the clinicians together, along with the private sector, along with the policymakers and decision makers, to look and see where we can get win-wins. Some of that low-hanging fruit where investment in our healthcare system has a short-term benefit, but has multiple benefits in terms of the medium and long term. And it's about finding those synergies. And you're right, Gareth, it's about bringing patients along that journey and being very much at the fore in relation to that if you're going to deliver that type of innovation.
Yeah, I completely agree, Denis. And one of the things I had as an experience, having worked in the National Haemophilia Council, I was the administrator, the sort of the back end. And I always remember when I met Professor John Bonner, he said to me, your job is to administer and you give me time to treat. And that always stuck in my mind. And when I worked in the NHS in the IT section, and you know how difficult it is for IT to be adopted across the health sector. I'll bring Amir in on this shortly. It takes a long time. Just for people who are tuning in, it takes on average about 17 years for systems to be adopted in health systems. So it is a tedious. But where I found the opportunity, having worked in previously around policy and then going out into the field when we were implementing an EHR, electric health record system, being able to articulate to clinicians that this would give you time to treat, it was in their benefit. That actually made them adopt the system like quicker. So, you know, there is that stakeholder engagement. Everyone has to win, Denis, like exactly what you're saying. Amir, let me just bring you in. And I just wanted to ask you about, you know, how can the health system, from your perspective, you know, collaborate with the public sector? How do we bridge the gap? We've got a lot of sessions today. So, for example, we're talking climate and health next, with the Commonwealth, for example. And then later on we have investors. How do we bridge? Because we work in silos, you know, like we're very much silo orientated. And this is one of the frustrating things with health systems, is we don't seem to be able to collaborate. You know, you'll have academic institutions like Newcastle Teaching Hospital will be doing pioneering research, but not necessarily speaking to Trinity College in Dublin, for example. How can we collaborate, and how do we actually get involved with minority groups? You're doing this in Manchester at the moment. How do we build that trust? I think we learned a lot of lessons from the vaccine program, going out and meeting people and building that trust. You know, what's your thoughts on that?
Well, so the first thing is it's incredibly challenging. You know, when you've got an NHS with 140 billion pounds worth of taxpayers' money in it, it is going to be political, and there's going to be a lot of people wanting to, you know, take charge of it, control it, that kind of thing. So there's two aspects to this. The first is who defines the culture of the healthcare system, whatever the system is, and it's no different to any organisation, whether it's public or private. An organisation has a board. That board has certain responsibilities, but that board determines the key performance indicators. It determines where it invests its money. It determines what staff it employs. It determines what buildings it has. It determines what IT systems you're going to introduce and how you're going to introduce them and all those kinds of things. The important thing, and again, evidence is showing that if that board, and not just the board, but I should say the very senior managers themselves reflect those who are in the front line, the ones who are at the coalface doing the work, as well as the people they serve, i.e. the patients, then there's a direct connection between the two. And therefore, because of that, this kind of decisions a board makes are going to directly reflect in the bottom line in terms of where the organization works. And certainly what I've seen within the NHS is that those organizations where the board has representation of those on the front line and those they serve gets much better outcomes than those that don't. Sadly, there's very few examples of that, and that's part of the problem which we have in the NHS. So it's boards and very senior managers. And by the way, the very senior managers are there because they're the ones who often write the policies that the board then signs off. So that's why we need to look at that. But there's another aspect to this as well, and I think that is about the democratization of the people. The NHS is not for the boards. It's not for the chief executives and the finance directors. It's for the people. And if we are truly going to grab this opportunity, we need to engage and involve the people. But if the way we're going to go about enabling that to happen, it's not going to be focus groups where the board says, we'll just go away and ask someone for some opinions about things. How about getting that lived experience that people have and putting it onto the board itself so that they can also get involved in these discussions to determine what kind of healthcare system we want, what kind of IT system we want. And just to be clear about that, if we talk about lived experience of those who are the most disadvantaged in society, prostitutes, homeless people, people that spent half their life in prison, refugees and asylum seekers, the very people that struggle to access healthcare services. And remember, I talked about an equitable healthcare system. If we were to enable people like that, give them the support and encouragement to get them to be able to sit on board to determine where the big decisions are going to be made, you'll see a very, very significant change in the culture of the organization, which really, truly puts patients at the center, making decisions and talking about the issues that Roxanne's talked about around goal setting and so on. And certainly, you know, I've seen that. I sat on the Equality Diversity Council for NHS England for 4 years, and the kind of discussions that were going on and sorts of decisions that were being made meant that very difficult decisions could be made at very low cost with amazing outcomes. And the kind of thing I'm talking about is, how do you take someone who's had a heart attack, who's homeless, who gets admitted into hospital, gets incredibly expensive treatment, but then has to be discharged in an empathic way, in a compassionate way, back onto the streets where they actually live? And that's the kind of difficult questions that we've got to deal with, but we can do it if we do it together.
Yeah, I totally agree. And Roxanne, you know, this is probably music to your ears here. You know, how do you bridge the gap between, you know, policy and patient, and how do you empower patient leadership, you know, shared decision making? I mean, this is a key component of what we're discussing here. How do you encourage people to stand up, like your story? You know, you took the decision, you want to be the captain of your ship.
Yeah, it is music to my ears. I've taken notes of everything I heard today. That to me is part of the answer. It's about personalized healthcare and recognizing the assets of patients and the patient community, as Dr. Amir Hannan was saying. It's also about trust. Denis, you were introducing the concept of human security. Again, that's very subjective in reality. What makes a patient feel safe? Maybe a person prefers to be treated on the street rather than in a hospital room because of whatever reason they have. I think to me, the key is really from a patient point of view, acknowledging that health is a part of life. And that's what makes it so hard, that we're not just living our life to be healthy. We have a lot of other things going on. We have history, we have people we care for, we have a job, we have trying to look after the kids and raising them to be good persons. So sometimes health goes to the background. And so as patients, what we can do is, one, communicate clearly with our doctors what is the reality, what is feasible, not feasible, rather than not going to the appointment, I just want a phone call. I think technology is enabling healthcare to take different shapes that fit better into different people's lives. So that's a first thing, to be clear on what is feasible and not at a personal level. And then from a policy maker point of view, I think it's the same as the same dimension, that be it on the healthcare provider side and doctors and nurses, or be it on the patient side, it's never one thing at a time. Yes, there's air quality, but there's also diabetes, and these people are also unemployed and trying to look for a job, and so several things happen at the same time. And as long as we look at things in isolation and in silos, we're never going to solve the equation. We really need to have very diverse boards. I loved your suggestion, Amir, about including the most vulnerable patients onto the boards. We could also have a task force, a thinking force that has an expert in education, an expert in employment, and all of that, so that we can solve the equation overall, rather than how do we get people BMI to decrease? How do we get air quality to improve? And separate tasks. That'd be a dream. I think it takes a lot of flexibility cognitively and a willingness to learn and to unlearn even before that. That takes time, I believe.
Yeah. Well, I think this is, you've kind of hit the nail on the head in terms of what we need to also understand from the policy perspective, and also when we redesign health systems, that over 90% takes place outside the health system. You know, the effects of what goes on around, you know, for example, if you have a complex condition or you're seeing a clinician or a consultant and you have cancer, you may only spend maybe an hour with that clinician over the course of 2 years treatment, for example, because, you know, most of the factors are actually external. So I think that's an opportunity. And if you look at the climate situation that we have, and that'll be our next session, that is a massive opportunity with all the money flowing into green transition. Don't forget that actually benefits our health and well-being, you know, so there is economic uplift for doing green, you know. So let me just do a final round robin. We only got about 4 minutes left. Denis, let me come to you. The future of healthcare and economics, are you optimistic? Do you see a lot of potential here?
I think there's a lot of potential, but I think, and Roxanne touched on it there in terms of policy issues. And like we have to make decisions. We have to look at a whole myriad of different things, not just the health aspect of some decision, but multiple different aspects of it. And I think what we need to do is to try and break out of these policy silos, because a lot of the evidence is presented to us in policy silos by the healthcare profession or by business and so forth. And one of the things that we've been trying to do within the Interparliamentary Union, within our working group, is we've developed a toolbox for parliamentarians where that they can engage with business and engage with innovation and science in a different way, in a learning way. To have an open mind in relation to potential solutions, but to engage with the innovators, to engage with business, to see, you know, what are our hard stops, our red lines, what are their red lines, and how can we come to an agreeable solution that actually moves the initiative forward, moves the program forward, that benefits everyone and delivers on each of our objectives.
Yeah, brilliant. I totally agree. And Amir, from your perspective, does the future look bright? Do we have an opportunity? Can we make a paradigm shift?
I think there's a mega risk at the moment with every healthcare system in the world struggling for the reasons that we've already talked about. Doctors are leaving, nurses are leaving, lots of burnout. Some of it may be due to long COVID and things. But of course, where there's a risk, there's an opportunity. And I think there needs to be a system reset, and we need to move from a national disease service to a proper national health and well-being service and focus on that, and maybe even international. I think people recognize that what we've got at the moment is not working. It's not sustainable. We have to move.
Roxanne, final thoughts. You're the patient lead here. You know, Amir is saying it isn't sustainable. We have to, I think this is very important. We have to be honest as well. We have to have transparency in what we're saying. The system is not sustainable. So, you know, do you feel this is an opportunity? I mean, Denis talked about bringing businesses in. I would even go further. We need to bring investors in. We need to actually go directly to the sovereign wealth funds. We need to go to the pension funds. We also need to articulate that there is money available if we have the projects and they're beneficial. So, are you optimistic?
I'm optimistic, mostly because we're here today, and that's the proof that there are people who acknowledge the problem and are very actively working at it. And I believe that patients are the glue. They're people. They're in touch with every point of the healthcare ecosystem. So yeah, we have a role to play. We will.
Well, look, fantastic. We've got a lot of comments. I want to just thank everyone who's joined us. Really appreciate contributions from Denis, Amir, and Roxanne. Do reach out to us. We're not going to stop here. The idea is to grow. We have a vision. We want to empower people. We want to give people the tools to manage their own health and well-being. Do join us on that journey. I'll be with you in about 15 minutes as I speak to Alison Raw from the Commonwealth. We're going to be talking about climate and health. That's our next session. But I want to thank everyone for taking part this morning. And we wish you well. Have a nice Friday and hope you can join us for the next session. Thanks, everyone.
Thank you.